Good morning. I'm Jeff Cleaver, the Executive Director of the Business Healthcare Group, and I'd like to welcome you to our first Delivering Value Series Symposium for 2022. And we are looking forward to when we can meet in person. And actually, our annual meeting is scheduled for the first week of May, and we will have two options, both a virtual option and an in-person option, and we hope to see many of you in person. So, housekeeping item, if you do have questions, please type them into the question box. And what we will do is we will answer all of the questions, or as many of the questions as we can, at the end of the presentation. So today you're going to hear about the culmination of a years-long strategic planning process and collaborative effort on the part of BHCG, the BHCG Steering Committee, Centivo, and our health system and provider group partners to reimagine healthcare and launch Wisconsin's first high-performance primary care health plan option, which was implemented by a number of BHCG member employers on January 1st of this year. And we have significant interest in the pipeline for during the course of 22 for additional employers to move forward. And we have a number of commitments from very large employers for 1/1 of 23. So and you're going to hear about the success that we have effectively been celebrating with our partners throughout the presentation this morning. Next slide, Jolene. Next slide, please. So the high performance health plan solution, and this is incredibly important, it's a business community and BHCG initiative that represents the continuation of BHCG's mission-driven journey to lead change and create value. But I want to go back and emphasize that this is a business community initiative. And we have changed the way in which we have been working with various stakeholders throughout eastern Wisconsin, and the way we're going to continue to work with them in the future. And it's very different from what the outreach was previously. So all stakeholders obviously have a vested interest in helping Wisconsin to be a great place to do business. Unfortunately, though we enjoy high quality healthcare with strong access in the state, we also experience very high costs with significant differences in cost effectiveness that are not linked to any measurable differences in quality. And you're going to see specific examples of that throughout the morning. Healthcare, unfortunately, once again, in Wisconsin remains unaffordable for employers and employees and their family. And many of you have heard me state this in previous presentations. The status quo is simply unsustainable. And we've heard that feedback from our health system partners and also our provider group partners. And they recognize the need to take cost out of the system. And we are very encouraged on the collaborative nature of the effort that has occurred already. So we know we need to work directly once again with the health systems and provider groups, and we have placed a great deal of effort in moving that forward. And once again, we're going to continue to do that. And we also know that strong relationships with primary care providers, health plan members, make better health care choices. Next slide, Jolie. So Centivo, once again, rigorous selection process, strong alignment. Next slide. And then the agenda for this morning. Ashok Subramanian, the co-founder in Centivo, will kick us off. And then Janet Lucas Taylor is going to talk about the advantage of participation in employers' viewpoint. And once again, the success that NML has had with moving forward the Centivo partnership. And then we'll move into advantages of participation, a health systems viewpoint with Paul Mason, who's the Chief Operating Officer of the Ascension Medical Group of Wisconsin, and then Dr. Bavishi, who's the President, Clinical Ascension Medical Group of Wisconsin. And then finally, Dave Ostendorf, the BHCG strategic consultant and chief actuary from Centivo, will talk about the high performance products offerings, and then we'll go into a question and answer session. With that, I'd like to turn it over to Ashok. Thank you.
Thank you, Jeff, and thank you to first of all the entire business community in Eastern Wisconsin. This would absolutely not be possible without your support, without your leadership. Jeff, to you personally for the effort and the blood and the sweat and tears that you've poured into healthcare and value in Wisconsin for decades now. To the Executive Steering Committee, and particularly to Janet, to you, the leadership that all of you have shown is really incredible. We've spent now the better part of a generation complaining about healthcare, but not embodying the change that we seek in the world. And BHCG, I think, like Gandhi once famously said, is truly being the change that it seeks in the world. And without your support, your partnership, your leadership, none of this would be possible. So really excited to be a small part of it. I think we've always described Centivo's role here as a humble catalyst. Without the support of the provider community and led by Ascension and others, without the employer community, the business community, there would not be the kinds of changes and results that we're starting to see in a very short time. And we're excited to share all of that with you today as a start of a longer conversation. So if we flip ahead to the next slide, the catalyst, as we describe it, are things that we've talked about now for a period of time. And so we won't read every piece here, but I think ultimately what we're showing as a model, not only locally in Eastern Wisconsin, but now creating attention, frankly, throughout the country with leading purchasers, with employers, with coalitions, with others interested in driving towards value, is the fact that a model that is built of the people, for the people, by the people, but substituting the self-funded employer for the people is something that can be done. For too long, we've been told it's not possible, that we can't change provider behavior, that we can't change member behavior, that we can't drive better value than what some of the largest institutions in America, the large carriers, the large networks can do. But in a very short time, with the focus, with the attention, with the drive, with the conviction that the parties around this virtual table have had, we have shown the opportunity to drive better value, drive better change, and we're proud to be able to be a small part of that. If we go to the next page, I always try to focus all of us on what's the point. Inaction is easier, but the point is too many of our colleagues, too many of our people in the community, too many of our family members, we've all personally dealt with issues of financial sacrifice when it's come to healthcare. We know people who've had to deal with it. The data has become numbing when we see the numbers around what people can actually afford and what their liabilities are if, God forbid, they get sick. But the personal stories and the anecdotes, I think, are what drive all of us. We've gone into this business, whether as a provider of healthcare, whether as a presider of the stability and the health of a workforce, in the case of the purchasers, we've all gone into this to make people's lives better. And Centivo recently did a healthcare and financial services study. It's available on our website for those of you who'd like to read. But very specifically, I think it brings to life real life anecdotes of the types of struggles that people have had, both in terms of their finances, in terms of their health, and particularly in terms of their mental health. One of the great insights of this study is that people's own health plan have actually led to a deterioration of their mental health. We can do better. And thankfully, with the leadership of the business community, we are on that path to doing better. But ultimately, it really has to be about reminding ourselves who is in the middle. It's the patient, it's the member, it's the employee, it's the family dependent. Those are the folks that we always have to keep in mind are front and center of everything that we're trying to do. If we go to the next page, so a reminder of what does all that mean? Well, what it means is, number one, fully contracted networks. Number two, having partners be engaged right up front around the table stakes of what it takes to drive value. Number one, competitive unit costs. Number two, a commitment to lead with those individual providers who, based on data and analytics, not political or social relationships, are shown to drive the best outcomes. Number three, creating flexibility, understanding that employers have different needs. And number four, creating flexibility, understanding that employees themselves have different needs. And so what we've created is a 3-network structure. Every purchaser in the community has the ability to choose either one or two of these networks. You can see the configurations. You can see that there are some common partners across. But the opportunity is for every employer, for every progressive advisor, on this virtual call, to think through, is there a way for me to capture value by redirecting care to those providers who have made it their commitment and have built business practices that go beyond talk to really drive towards cost effectiveness without compromising on quality. And you'll hear from our partners at Ascension on what they're doing, and you'll see why they're in all 3 of these networks. But recognizing that the geography, personal needs, purchaser needs require flexibility, we have constructed a set of offerings that really enable there to be no compromise in terms of the types of providers that any individual purchaser might want to have available in their networks. Beyond this, there are options through our partner at HPS, as well as our partners at Cigna, that enable for those employers who need to solve for multi-site issues and need to offer broader access beyond the 23 county service area that Centivo has directly contracted. If we move along to the next page, the big part again that comes from the fact that we really have the key stakeholders of employer, purchaser, business community, employee, and provider, and Centivo again playing that role as that humble catalyst to pull it together and be the administrator, is the fact that these components really do work together. Getting curated network access at the provider level and working at the individual provider level, that's a big change from a healthcare delivery perspective than anything that we've all experienced for 25 years. To put a fine point on it, and you'll hear a little bit more about this as we go deeper in this presentation, we are looking at individual providers, individual PCPs inside of practices and letting the data drive whether they are included or not, whether they are selectable or not. And not saying you're excluded forever, but creating transparency so that we can raise the bar, that we can elevate performance of those who may not be there today to include them in the future. That type of curated experience, which is so different from what we've built before as an industry, then requires the real engagement and partnership of the health systems themselves to make sure that their providers are aware, their front desk staffs are aware, to make that member experience something that's easy to use. And so again, I thank the partnership of our colleagues across the provider community, across the logos that you saw on the last slide, but particularly those from Ascension on this phone call. What they've done, number one, is train their staffs up front, enable the easy transfer of electronic medical records for those who have changed practices. And when there have been hiccups, they've jumped all over them. So appreciate your partnership as we've continued to move the ball forward here. The other piece, and you'll hear Dave speak to this towards the end of the presentation, is what I'll call a maniacal focus on total cost of care. Unit cost matters a lot. Good providers matter a lot. Quality matters a lot. But I think we all have to lift our heads up and recognize that we're having this conversation not in any normal time, but in a time coming on 2 years in a global pandemic. It's an unprecedented shock to the system for the delivery of healthcare when we've had spikes in demand due to COVID, and at the same time, pressing workforce shortages due to the supply side impact that COVID has had on healthcare workers everywhere. And so what we've really tried to do is say, look, we're not looking for the cheapest rates. We're looking for fair pricing. But ultimately what we're looking for is that total dollar going further. Better quality, fewer complications, less recurrence, better results. And I'm looking forward to hearing a little bit more, from our partners on the kinds of things that they're doing to make sure that this isn't simply about a discount up front and more utilization on the back end, but really making sure that that total dollar and that patient experience are what's being prioritized on behalf of the business community in Eastern Wisconsin. So with that, if we move along, the last piece I think we'll share, maybe a couple last pieces here, is the thing that I think we have all in the back of our minds struggled with is, can we really change things on the ground? And you see some early stats. We're 5 or 6 weeks in. But the most important thing that I think has been demonstrated is the fact that a plan that is built for the self-funded employer, a plan that is built that curates and designates individual providers who the data has shown performs really well, that it can actually work in real life. And so you see some of the metrics around 82% of PCPs available. That means 18% are not, because the data didn't support it. We see results on referrals. We now have thousands of claims that have come in through the system. We have everything from the most complex to the most routine being taken care of. And importantly, we have employers in this business community being recognized that this is a new plan that was built for them. And ultimately, the satisfaction and the stability of this will be completely dependent on making sure that those needs of the self-funded employer are being put ahead of everybody else. Something very different, not only from Eastern Wisconsin, but from this whole country, where really it's been the fully insured objectives of insurance carriers that have typically been what's driven the train in healthcare delivery. So if we move ahead, I'm going to hit an example, and one of the things that's been really exciting to us at Centivo is the fact that our first cohort of employers that have gone live has been incredibly diverse. We've had members of the executive steering committee from the BHCG who've been loyal soldiers in driving the value conversation for decades. And we've had brand new members of BHCG who've taken this opportunity to join forces with the rest of the business community. We have organizations with tens of thousands of employees, and we have organizations with a little over 100. And a good example is a local automotive group who is facing a significant increase and decided that this was the opportunity to move forward and not just become part of this broader initiative that BHCG is leading, but really take a stand that in order to be a successful enterprise overall, that taking care of its workforce, driving towards affordability is critical. And so you can see some of the details on this page, but ultimately what I'd like to focus on is the fact that 85% of employees opted for an option. Other choices were available, but opted for an option with a zero deductible plan that enables the fact that that extremely affordable level of coverage is tied to understanding that there's a network of providers that are committed to value, understanding that the care journey starts with a high quality primary care physician, and that downstream care needs to be coordinated and guided by that primary care team. Those are examples of member behaviors. We've talked about provider behaviors. Those are examples of member behaviors that, again, we've as purchasers, as consultants or advisors or partners to purchasers, have wondered about, would people really embrace it? The answer is, if given the choice, many of them are. And they are, and you'll hear more from Janet in a moment about her experience, but they are because we have to, I think, continually remind ourselves of the day-to-day reality of the lack of affordability in healthcare and the sacrifices that we have imposed on our colleagues by not being able to make these higher value options available. So if we move along, and I'm coming up towards the end of my time, some examples of things that we're going to keep pushing on in partnership with all of you. So number one, I think a big question we get is, how do we expand and enhance the network? So as we're in this early phase post-launch, a lot of our focus is to make sure that everything a family might need, from the routine, the complex, the common, the rare, is available and is available easily and with a minimum of friction. So there's a lot of sculpting and pruning, if you will, that's going on in the geography that we're in. And we're also looking to intelligently expand to work with BHCG to serve more employers in the market. The second is the inclusion of a virtual primary care capability that's not simply a traditional tele-urgent care option with a new name, but rather is one that is truly integrated in with our partners that can do the same kind of advanced primary care work that the best of the best local community PCPs can do, but is an added way to engage unengaged patients and also to meet the needs of employees who want to get their care in a different way. Another piece that we're working on with a number of members of BHCG is, how do we take some of the work that's being done in the community and better tie it with employers' own goals when it comes to on-site and near-site clinics. We have to supplement, expand, improve what's working as opposed to looking to fully replace, and integrating downstream referral networks with the existing trust that employees have in their on-site and near-site clinic partners is a key way to unlock that source of value. And then lastly, the research and the data and the analytics is not, think of it as more at the beginning than the end. So we're proud to say that so much of what Centivo has been able to do in the market with its partners is a product of BHCG's commitment to data and transparency. That will continue, again, with the goal of not excluding, but of raising the bar and hoping to include more and more over time. So we've utilized the results of the second annual physician value study and exploring kind of version 3.0 of that study, more to come on that. So with that, if we move ahead, I'm going to turn it over to you, Janet.
Great, thank you. Thanks, Ashok. And thank all of you for your time and attention this morning to learn a little bit more about Northwestern Mutual and our journey to the high performance plan. I just wanted to start with maybe grounding everyone in kind of our goals as an organization for employee healthcare benefits. I mean, we really try to offer our employees the highest quality care and providers. We support well-being and then also want to provide the best and most comprehensive coverage for our employees and their families. We know that in order to achieve these things and reach these goals, it requires us to evolve our healthcare model and our programs over time, really concentrating on putting our employees first with the right information and support to make the best decisions for their families. Next slide, please. We as an organization have a long history of leading and driving the market over time. We've been on this journey to high quality care for a long time, and just wanted to maybe kind of highlight some of the pieces in this journey. You know, back in 2010-ish timeframe, we implemented consumer-driven health plans. We were also part of the Business Healthcare's Group's initiative with the Humana Narrow Network locally until 2016, when Northwestern Mutual implemented United Healthcare and premium tier 1 designation. Again, just this evolution in the drive to driving our employees to higher value healthcare in the market. We, at that time, added plan differentials for our employees to utilize premium tier 1 providers. And then most recently in 2021, when I think most of our employer, comparator groups were sitting back and not making many changes, Northwestern Mutual implemented full replacement HSA plans. We did adjust our cost share that year and really tried to boost employee well-being. As we were facing 2022 and what we would do for employers, we started to talk about what are those avenues that employers always seem to go to, and it really ends up being adjusting our cost share to our employees or modifying our plan design in some way to help manage cost and keep that in control. And we came to the conclusion that that's no longer really a viable approach for Northwestern Mutual. And we're very excited and involved with the decision of the Business Healthcare Group to pursue the High Performance Network. Next slide, please. But as we looked at planning for 2022 and trying to make this move, we needed an easy way to explain to our internal constituents what is the problem that we are trying to solve. So we use this example. We had said, let's say that Northwestern Mutual puts a variety of waters in our vending machines. And we can tell you that the cost of the water varies by up to 200%. And the quality of water also varies significantly. And in fact, at least one of these waters, we wouldn't recommend that you consume it at all. But we are not going to tell you the price of these waters or the quality of these waters until after you've made your selection and drank it. That's healthcare. That's how healthcare is perceived by our employees. And we really encouraged our leadership and our internal teams to think about the importance of the work that we're doing in partnership with the community and our partners to work to create change and to be successful in this area. Next slide, please. So for us as an organization, when we think about what we are trying to achieve with the high performing network over time is, in maybe 3 buckets. Kind of first, just sending a signal to the national health plan partners that the status quo isn't acceptable to us, that broad networks with limited transparency to quality and cost and direction for our employees isn't going to work for us in the long term. And then to the provider community, that we really care about quality and value for our employees, and we want to work with you to make that a reality. Increased transparency and communication among all constituents, and really letting the business community have a voice in these discussions. And then lastly, and most importantly, is better care and outcomes for our employees, the business community, and really having a focus on increased compliance and evidence-based preventive medicine. Next slide, please. So our journey in the high performance plan and what we've achieved for 2022, just want to maybe baseline that. For those of you who don't know, about 40% of those employees who were eligible for the high performance plan actually selected that plan. So we offered Centivo alongside of our UMR plans. There are 2 UMR plans. All of our plans were high deductible health plans with HSAs. And we offered the Wisconsin 2 network. So as you think back to Ashok, we offered the slightly narrowed network. And then we also offered Centivo in our greater New York market. Of the 3 plans, employees selected Centivo more than any of the plans that were offered. I think there are some key reasons and things that we did that really helped that overall engagement and selection. First, our approach internally and within the market was the strategic alignment and collaboration that we've had for over the last 12 months or so with all stakeholder partners, and just making sure that everyone was moving in the same direction and aligned. When we started to work on plan design and contribution strategy, we made a conscious decision to stay aligned to our guiding principles at Northwestern Mutual and our employee preferences. So we did not move away from our high deductible HSA plans. We felt they were integral and something that our employees really wanted to hold on to. And then we applied appropriate steerage without over rotation. And by that, I mean, we didn't make this the clearly directed financial choice for employees. We wanted this to be a combination of sharing the savings and things that we would have, but also a philosophical and ideological choice for employees to receive better care, to have better direction, and to really understand the benefits of the plan. And that I would encourage everyone who moves in this direction to communicate heavily and often. We worked in partnership with our experts. So our employees had the opportunity to hear from Centivo directly about how the plan works, why we were doing the things we were doing. We also invited our health plan partners to do webinars with our employees on the importance of primary care and their view of how that care can benefit employees and their families. We held office hours for the month prior to open enrollment. We did that via Slack, and employees could come, ask questions, and get answers in real time. Centivo was a fabulous partner to us during that time and participated in those office hours, which was indispensable for us and my team as we learned. And then knowing that many times employees have a spouse or a domestic partner at home that help make decisions related to healthcare, we made all of these webinars and all of the things that we did available to spouses and domestic partners. As we've moved forward past, successful open enrollment and into the plan, we knew that employees would still have questions and need support and forget maybe why they made the choice and how the plan works. So we have ongoing education and support for our employees. We have a dedicated high performance Slack channel where employees can ask questions and share feedback and learn from each other. And then we have started a webinar series with Centivo. So we've been looking at what are the most common questions that we're getting from employees and designing short sessions over the lunch hour that are taped and reposted to answer those questions. So I think with great support and thoughtful preparation, others can be just as successful. We are really looking forward to seeing, kind of mid-year and end of year how the plan performs. But so far, our experience actually has been very positive from employees that have selected the plan. And with that, I think I am turning it over to Paul Mason. So take it away, Paul.
Thanks, Janet. Hello, everybody. Paul Mason, Chief Operating Officer of Ascension Medical Group, Wisconsin. With me today is our clinical president of the medical group, Dr. Bavishi. And we're going to talk a bit about what it's like to be part of a high-performing plan like this from the provider's perspective. So what it's like to be in our shoes and what we're thinking about when it comes to the opportunity, you know, that we have here. And so, Dr. Bavishi, I know you're going to talk initially here about population health. I'm going to speak a little bit about the operations after that. So I'm going to turn it over to you, Vern.
Yeah, thanks, Paul. Good morning. Glad to be here. You know, just as we heard this morning, it's great. We got the perspective from the member, the patient side about healthcare, but now let's talk about the provider side. I'm a pediatrician by trade, so primary care is near and dear to me. And so when we think about population health, let's talk about just the ecosystem of healthcare. You know, when you say the ecosystem, the landscape of healthcare, hospitals come to mind, insurance, specialties, emergency room, urgent care clinics. But really, the door opener into healthcare, when you think about that for a moment, the reality is it all starts with the primary care. That is the door opener that gets you into all those other fundamental components of the healthcare ecosystem. And so that door opener is really getting the patients establishing care with the PCP. So as we think about this current setup that we have with Centivo, we have to make it easy. I think I heard earlier, yeah, we can't go with the status quo. You're right, we can't. So we have to make it easy so that when the patients, the members are in to see their establishing care with their providers, we have to make that process easy. And so this process with Centivo was actually done really well, which was here's your list of primary care providers you can establish with, and here's the numbers, and go ahead and make the appointment. It sounds simple, but that step, getting them engaged, worked really well, because from our end, on the provider side, now that we have that appointment set up, I think it was stated earlier, we have a process baked in. You're a new patient. You're coming in from the Centivo partnership. We have it baked in so that we will have your records sent to us prior to that appointment. Now, there's going to be times, I will tell you, where sometimes the records may not be at hand just due to timing. But please know that's okay. We're still going to take care of the patient. But you know, we've had some good feedback already regarding our process baked in for that. So step one is really, once you create that relationship, what's next is really building that trust. If you think about population health, primary care, this is building relationships, but then building trust. And that's important because it's really a team-based care model. You can have providers that want to really kind of state, okay, this is what we need to do, but the patients need to be engaged and vice versa. And so that's where the magic happens, is in the exam room. That's where that shared decision-making occurs. That is where, as providers for primary care, look, we're going to address the preventative things when you're in the office. We're going to take care of your preventative needs. That's your screening, such as colorectal screening or mammograms or whatever applies to that member at that time when they're being seen. However, I think it's also important for you all to know that when patients come in, and if it's an acute visit or managing their chronic illnesses, this is also an opportunity to talk about preventative. This is where, if you come in and we're talking about managing the hypertension, we're also going to take that as an opportunity to get you up to date on your flu shot or your COVID shot. Or let's talk about some screenings that haven't been done yet. So anytime the patient's in our office, we use that as an opportunity for really trying to help manage the preventive care. That's truly the essence of population health when you think about it. It's really trying to manage it at all times when at all possible. We know there's going to be times where we may not be able to give that immunization, but that's okay. At least we have that dialogue. We have a follow-up stated as such. But this is where, again, it gets back to the relationship. When you have an engaged relationship with the patient and the provider, that's where then you kind of work together. And then what happens after the patient leaves the office? It doesn't end. just right there. So with our current setup in our medical group at Ascension, we have a population health team that's really keeping a close eye on our screening, on our metrics, on our chronic care such as diabetes, hypertension. This is information that's passed to our providers. They see their scorecard. They want, I mean, folks go into primary care because they want to make a difference. Same thing with specialties, but primary care is really building that relationship. And so the scorecards are critical. It's not a top-down approach. This is your information, providers. How can we help you? And really, we give them the resources and tools that they need, because this is a team-oriented approach. If you think about with COVID, what's happened right now, we have actually a fair amount of patients that delayed care, delayed their screening. So we've taken upon ourselves where, when I say ourselves, our providers are saying, how do we reach out to the patients? So let me give you an example for the mammograms. We're reaching out to anyone that hasn't had their mammogram, and we're scheduling it. We're basically having the scheduling team calling up patients saying, you're overdue for this, and how can we help you? We have to make the process easy. So step one, I'm going to go back to where we were earlier in creating that relationship. We made that easy. And for the provider, that's exactly what we're looking for. Well, now on the provider side, what do we need to do to make it easy so that the patient can get the care that they need? And that's what we're looking at. Those are the processes that we have baked in, so that, again, the status quo, we can't continue. I think it was also mentioned about telehealth. Yeah, absolutely. In primary care, especially now with this pandemic, there's definite use of telehealth. We're taking it what we call the 2.0 version. So that means for primary care, we're utilizing this as an opportunity, as an outreach. We can utilize it for triaging, as well as also managing the patients via telehealth. So that's something that definitely we're excited about expanding and growing that program. We're calling it the Command Center, and we're excited about that as well too. So we talked about the scorecard on quality. I think that's important, but then also the patient experience. I want to make sure you all know that that is also part of our key metric that our providers have at hand to know what they're doing, because we want to hear back. I look at this as feedback's a gift, and we need to know, are we providing the care that we need, and to the patients that are in our office feel that we're doing our job? And so that is something that we take very seriously as well too. And we're looking at not just internally, but also against national benchmarks, because I think that's important. It's one thing to look at it internally, but how are we performing at a state level, as well as looking at it from a national level? So we have a pretty good infrastructure. That's what we're excited about. And this is where partnering with Centivo, looking at this data, is going to be helpful, because this is where we need to just continue moving forward, making things easier, again, on the patient side, but then also on the provider side, so that we could do what we do best, which is we want to take care of the patients. And that's what's exciting. And so you've seen some of our data, you may have heard, but this is why we've been chosen. It's because of this infrastructure. But the magic happens more on the operations side as well too. And that's where I'm going to pass it to Paul to talk a little bit about some of that.
Yeah, next slide. Thank you. Getting our teams together, this has been really an exciting time for us. Talking about bringing a model of care into our system that we have been waiting for years. We have been preparing for. When we brought together Ascension Medical Group several years ago, we said we're going to stand for quality. We're going to stand for access. We're going to stand for the patient experience, and we will win, and we'll be stronger if we can deliver on those things. When we heard that we were going to have this opportunity, we really celebrated it across our provider group. This was something shared with the whole team, that it's because of their hard work, their focus on quality, their focus on service, that we're going to have an opportunity to actually deliver healthcare the way we've always wanted to deliver it, right? With primary care being the hub, being the model, being the quarterback, the health coordinator, primary care is the center of that, patient's experience. And, this is something I think we've all wanted, for years, not only on the primary care side, but also on the patient side, where there's not barriers to primary care. They don't have copays. They're not worried about having to come in for another doctor's visit. If they need to see their primary care physician, we're going to be available. And so we shared all of this with our team. They understand, how exciting it is for us to be able to continue to deliver this in a model where it's valued by, the patients, by the employers. And so, the last 6 months been great. We've trained all of our staff. And it's not just the selectable providers. And I know, as we were talking about, a number of providers weren't selected, right? We spent a lot of time with them talking about why they weren't selected. They maybe didn't hit certain cost and quality measures. And, there's room for improvement for that. But those that were selected, we were able to celebrate that. We can talk about their accountability now in this model. But we could also talk about the patient's accountability. And so this is truly a relationship that, as Dr. Bavishi was saying, it's the relationship that primary care wants, right? And because when you know that you got this group of patients who who they are, that they have a shared accountability, that the model of care, they're fully engaged in it, where primary care is the hub. You can develop and you could set up resources from an operational perspective around those patients. And that's just what we did. We developed a dedicated scheduling team so that there's a consistent, high touch experience. There's a single way for them to call. They don't have to try to memorize all the different clinic numbers or try to figure out what Dr. Smith's number is versus Dr. Jones. We've developed that so to make it easy for them, because as Dr. Bavishi mentioned, making it easy for the patient and then making it easier for the primary care provider is really, the cornerstone of this model. Primary care then, they have the degrees of freedom then to do all the assessments, do all the work that Dr. Bavishi, described, and then look down and say, yeah, we do need to refer you to a specialist. I'll take the responsibility for that. We'll communicate with you, and we'll put in the referral. So much better, right, than just finding out that your patient, without your knowledge, went off and saw a GI specialist because they had a bellyache, or they went off to see a neurologist because they were having headaches. Well, it hasn't even been really worked up yet. So there's so much, that we can do in a model like this, where where the patient has to come to you first, and we can educate, we can talk about, what the opportunities are. So again, a couple other things I think, again, I was talking about the referral process there. That is so key, because it allows that relationship between the primary care provider and that patient to really develop. They have to talk about it before the patient goes off to see a specialist. And then, the other thing that we've really done around preparing our team, and some of this, for those people in the audience that are healthcare, professionals, and I know there's a number of you here from other systems, it's all about how do you prepare your teams, right, for welcoming new patients and doing something different. And for us, we really built in a lot of EHR, electronic health record reminders. We talked about how medical record retrieval and having all that in hand, right from the get-go is so important. It's an important part of that process. We have reference documents, training documents, all sorts of education that we've done with our teams. So they know this is a different model, and they're excited to be part of it. We're excited to be part of it. And they know that we have an opportunity to have this grow, that this model where primary care is truly the driver. And so again, a terrific time for Ascension Medical Group, Ascension Wisconsin. We want to thank all of you. I thank the employers. We want to thank Centivo, for giving us a chance to deliver on a model that we've been wanting to do for years. And it just syncs up with the culture of yes that we've developed across Ascension Medical Group. And our culture of yes really is specifically getting at access. Our culture of yes is specifically getting at, we'll work with the patient on what their needs are. And perhaps they want to be seen virtually. Perhaps they want to be seen in a different environment. We can do things like that when we have shared accountabilities and shared understanding. So with that, I'll stop there. I think we're going to be turning it over to Dave next. So with that, I'll turn it over.
Thanks, Paul. And I'm going to, I think, wrap together some of the ideas that you've heard in this session and talk to some of the things that really get at a key question. And it's something that we hear, relatively frequently is, is this really different? A lot of the words that you may have heard, you've probably heard for years. Is this really a different solution? I think you're going to see that the answer really is yes. And I would point to the 3 things that are on this page, but I would also point to a number of the words that you heard from the other presenters today. Words that were used on a regular basis: alignment, relationship, guidance and education. Those are things that are incredibly important to this model. And what they really do is take a lot of the aspirational ideas that we've had for years and make them real. And in looking at that, I would start with the very first one on this page, which is data and analytics. To really be able to do this well, you need to take advantage of the fact that the whole area of data and frankly the big data processes, artificial intelligence opportunities, those type of things, really are something that we haven't had before. And we are now really able to take advantage of that. If you take a look at a big data set like the claims database that comes from the Wisconsin Health Information Organization, the state's all-payer claim database, you've got a gigantic amount of data. You need to be able to do something with that. The employers, and this is something that BHCG, I think, gets a lot of credit for. The employer said it really is incumbent on us to go and push this idea. We shouldn't wait for a think tank to do this. We shouldn't expect insurance companies to do this. We shouldn't expect other third parties to do it. We're the ones who pay the bills. Let's really get behind the data. And so when they commissioned the first physician value study with GNS, they said, we need to go further than has been gone before. And the second study really took took great advantage of the learnings from the first study to say, let's use even more data, let's make it more robust, let's make it more sophisticated. This study, for someone like me who's been in the industry for way too many years and been an actuary for a very long time, this is one of the most impressive studies I've ever seen. And what the study does is really look at that foundational question of which physicians are getting their people back to their optimal health using the least amount of resources possible. It really is who is efficient at doing that, who hits all the quality metrics while being efficient in the use of resources. And that is something that's a fundamentally important element. But one of the things that has been a commitment from the employer side as they commission the study, and which Centivo is helping execute on, is the fact that this data has to be much more transparent than typically has been the case in the industry. We are made available to the health system part, excuse me, the actual results. And anyone who is a WEO member within the health system world can go down and drill down to individual physician performance and not just say, here's my physician score and that came out of the model and we're done. They can go and look at it from, for example, the clinical disease, classifications and say, which of my physicians are doing a good job of managing diabetes? Who's doing a good job of managing hypertension or gout or any of the other elements that were in the study? And so you can drill down very deep into the study and really look at who is managing it well and who is managing it less well, to do some comparative analysis and to get information both across provider practices and across systems to really be able to make some changes and really put it into a continuous improvement model. That has been a key element for the employer community. The business community has said, if we're going to do this, it's not to set up a system long-term, which always subsets physicians and says, here's good and here's bad. What it says is, let's really push to make improvement in the system so that all physicians fall into that high performing bucket. That's the right end state. And that really is a collaborative process between the employers, who obviously at the end of the day, it's their money along with their employees' money being spent, and the healthcare providers who are receiving it. And if we can put accountability into the system, and if we can quit just talking about what the data is, but instead make it actionable, that's where change really happens. And so I give a lot of credit to the health systems within the state who have come to the table on this. It's hard to do. No one is debating the fact that change in healthcare is anything but challenging, but positive change is absolutely necessary. And so, part of this is to get to a point of an alignment. And that alignment, as you think about it, really comes from multiple elements. The data tells us who are the high performing primary care physicians, and in the larger specialty spends, who are the higher performing specialists, and says to a health system, we want to take advantage of your high performing PCPs to guide the care of our patients. For those who aren't performing as well, we'd like you to raise their game. We'd like you to be referring to the higher performing specialists. And again, for those specialists who aren't performing as well, let's look at ways to raise the game. Let's make sure that that actually happens within a benefit program that is structured, designed with benefits that steer people to say, yes, you have to have a strong primary care relationship. It is a necessary prerequisite to good care. It is not an optional. It's not fill out, check a box and say, here's the name I put on the list and I'm done now. I've got a primary care relationship. You actually do have to have a relationship. You actually need to talk with and work with your primary care physician and their team. You actually need to work with them to guide your care. You're going to get better care that way, but your benefits are predicated on that. If you choose not to do that, if you don't establish that primary care relationship, if you choose to simply ignore the guidance you're getting, your benefit is much different. In that simple piece of alignment, saying, yes, you have to have that relationship. You get a great benefit when you have the relationship and a much lesser benefit when you don't, is a very strong element of this. And then there's little things that go into it. Once people have chosen their primary care physician, having Centivo make sure that information is back in the hands of all of the primary care teams is really important. Here are the patients who are on your panel from our perspective. Here's who we're going to hold you accountable for. It sounds like a simple thing, and yet it's really a missing element that has happened in healthcare in the past. What we heard from primary care physicians when we talked to them prior to setting up this model is, we hate retroactive attribution systems that say at the end of the year, oh, here's the patient that we attributed to you, and how come you didn't do better? Well, if I didn't know it was my patient, or if it's the end of the year and you're asking me to go back in history and fix something, I can't do it. Give me a proactive system. Paul talked about the fact that this really is healthcare the way it should be. It's the way they've been asking for. That mechanism really helps make that happen. There's really strong alignment. And then we went in and we did some hard things relative to the contract and said, yes, we're going to be looking at subsetting until you can bring some of the primary care physicians up to the level we need. We're going to look at paying a bit differently. That difference means we're going to pay less on a pure fee for service basis and more in things like patient management and incentive fees, so that you really are sharing in the success of the process. We're giving you money to manage your patients well, and we're rewarding you when you're doing that, but we're expecting you to do that. And if you're ineffective at that, it won't be as good a financial deal. Those kind of elements are important, and we're going to look at ways to continue to regress that value-based reimbursement model, to continue to push along the fact that there is a real alignment opportunity there, that really this is the people who are paying the bills for value, and the people providing the services receiving the payment for value, and we're moving away from the historical volume-based approach. Those things are important. A lot of the elements that you've heard today really go into the very practical. How do we make these things happen? If we do it well, things like specialist referral management become a big plus. People understand it within the context of, this is really good guidance and really good help to get the best care. If we do it poorly, it's a hassle. And let's face it, a number of us can go back to the old days of HMOs where the specialty referral process was basically a reason to try to keep people from getting extra care, and it was a hassle. And people still have that historical memory relative to referral management and see it potentially as a problem. But the first time they really need something and can work with their PCP and get a referral to someone who really is going to help work on their condition and have it be easy and have it be straightforward, they start to see that positive changes happen. And let's face it, when you look at simple things like the use of technology, it is so much better than it was 15, 20 years ago when we lived in the old HMO world. I can now text my physician. I can now email my physician. I can now have a virtual visit with my physician. That's a whole lot better process than, oh, I have to find a time to get an appointment, to go into the office, to go have them talk to me, to then get the referral, to create additional problems. Technology helps us. And now as we move into a world of things like virtual primary care, where for a number of our people who live their lives, at least partially on a pure virtual basis, if I can have a physician who is comfortable with the virtual process, that's something that really fits me, something that's very consistent with my life. And so that the advent of that has been really important as we talked with folks like the folks at Ascension and the investments they made in virtual care. As the pandemic hit, there's very few silver linings of a pandemic, but frankly, that's one of them. The real quick advancement of virtual care within all of the health systems and within the provider partners that we have, I think is something that really is an element that we are going to take advantage of. When you look at some of the reasons that employers set up various structures that they did, on-site clinics were a good example of that. There was concerns about access. There was concerns about cost. Employers and give Northwestern Mutual credit. They did a very nice job of setting up their mutual health centers, a very strong primary care structure. It started out basically as being a nice, convenient urgent care center. And they have been continuing to transform their model into the mutual health centers becoming strong patient managers. And that movement can continue in a model like this. And we can continue to use the data to help the on-site centers do a better job of referral management to get people to higher performing specialists. All of those elements are, I think, fundamental to this model that really create an opportunity and continue down that path of alignment. You've got to have the pieces working together so that when people hear big picture ideas like find a great performing primary care physician and work with them, yeah, that all sounds great in theory. You got to see it in practice. We get messages back from folks in this plan saying, I was a little worried about it. There were some early issues where I was trying to learn these things, but you know what? I found a really good doctor. I hadn't had that before. And while it's changed and everybody has a little bit of challenge going through the change process, when you hear answers like that, it's important. When you hear things like, oh, I was someone who didn't really ever go to any doctor until I had to go to the emergency room, but now it was easy, I did something different, and I actually for the first time in 5 years got a physical, and it showed a couple things I should be working on. And you can look at the results and say, this one's someone who is a train wreck waiting to happen. And all of a sudden now, they've got a relationship that is helping manage their physical state. Those are things that are rewarding. So all of this, I think, boils down to the fact that we can take advantage of a advancements that we've had in the healthcare systems, in the data opportunities, in the way we pay and the way we communicate. All of those are critical elements, and they all combine to really make that positive change happen in a way that really does move the place. We kid about the fact that we get kind of the subtle messages back relative to can the provider community accommodate this? Can members accommodate it? And we spend a lot of time looking at all those little hiccups where it doesn't work perfectly. And I will tell you that flat out, it's always a challenge to bring things in first year. What happens when you get really good partnership between the employer groups, between us as the health plan, between the provider community, you fix the problems and you fix them fast. And I give great credit to our early adopters who have given us very direct and very helpful input in terms of making the change happen, in terms of looking at things that can really improve the processes. We are all, I think, feel like we're in it together, and that's really important. As we continue to expand and continue to have more employers move into this, it becomes easier and easier to commit the resources at the provider system level. So we look forward to that kind of expansion. And we think, we are starting to see all of the right elements, the early engagement by patients that are going to prove out the financial results that we're all looking for as well. When you look at Centivo and other marketplaces and what we've been able to achieve, the savings really have been quite profound. And an awful lot of it comes back to having that strong primary care relationship. There is so much care in the current world that is just ineffective, inappropriate care, and a lot of it's because people get lost in the system. And if I can have them, someone help guide them from the start to the finish line in a much more direct way, getting the best care at the right time, I get rid of a lot of that additional churn, which is really expensive and really ineffective and doesn't help anybody. So there's a lot of opportunity out there. With that, I'm going to pull up and see if we have questions that have come in from the audience, and see if there's other things that we can address. So Jeff, I think I will turn it back to you and see if anything's come in.
Okay, thank you, Dave. Once again, if you do have any questions, please type them into the question box, and we will provide those to the presenters this morning. But before we do that, Jolene, can you go back to slide 9, please? Okay. Actually, I do have to offer a heartfelt apology. I cannot believe this has occurred, but we omitted Children's of Wisconsin from Wisconsin 1, Wisconsin 2, and Wisconsin 3. Children's of Wisconsin is participating, and I can assure you that they are participating in all 3 of the network options. So to the executive team at Children's, really do apologize for this oversight. Really don't know how it occurred. And what makes it even more embarrassing for us is, and many of you probably don't know this, Children's has been a business healthcare group member employer for years. So once again, heartfelt apologies to all of the Children's staff, including the C-suite, their executive team, for the omission. So Jolene, can you go back to the question slide, please? So the first question I have, and I'll let all of you determine who wants to take it, but Dave, it might be best for you. So how does individual, because this goes to the GNS and other tools that Centivo utilize in determining the physician panels. So how does individual provider ranking work when the primary care provider refers to hospitals of their affiliation? How do you rank individual providers within a given group? Aren't they all bound by the same rates?
It's a good question, and I'm going to give you a very quick thumbnail of the study to be able to answer part of that, because what the study does is take a look at the claims data that puts together episodes of care that are managed by primary care physicians. And basically what you're doing is looking at their performance relative to the amount of resource they use to really help their patients. And the critical element of the study is it is not based on contractual rate differences. And so it was not intended to try to look at who has high prices and low prices. It was really looking at cost efficiency. And that's critically important to this question. What happens as we look at that and bring it down to the individual physician is if you take a look at the episodes of care that they have managed, and for example, look at how they are managing their diabetics. There's a look at how much of the care is done in office versus inpatient versus outpatient, what drugs are used, what tests are put in place, what processes are undertaken. Those are critical elements of getting to the cost efficiency. We marry that with the quality data, and the quality data is based on evidence-based medicine compliance rates. And so we really do have a good snapshot as to who is following EBM practices. At the same time, they're doing things on a cost-efficient basis at the individual physician level. And then what we have done as we've talked to the health systems in this program is that, we are practical enough to recognize that you want to keep care within your system. It is a logical outcome that said, if I've got a Ascension primary care physician, I'm going to stay within Ascension specialist groups and Ascension Hospital to the extent those capabilities are there. We have said very directly to them, we appreciate that. We want to make sure that we're taking advantage of your best assets. And so looking at it from the standpoint of, can we have your high performers referring to your high performers using the best practices you have in your community is really a critical element here. And that's part of what is expected under the contractual process that we put in place. It also uses the data out of the GNS study to help create that ability to drive care. So from that standpoint, if you take a cost-effective PCP, have them referring when they need to refer to cost-effective specialists within their system, that really has a very strong outcome relative to the savings opportunity, and is the way the program is structured.
Okay, thank you, Dave. The next question has two parts. The first part is, do you have plans to expand beyond eastern Wisconsin to the rest of the state? Dave?
So short answer is yes. We're looking at expansion both west across the state, the Madison area, and then north and into the north central area of the state. And so have additional conversations going on right now with provider groups. One of the pluses of having used the WIO database for the physician value study is we have the entire state of Wisconsin evaluated. And so the source data is available to replicate the process we've used in eastern Wisconsin across the entire state.
And the second part of the question is, are there plans to expand the provider network beyond physicians to PAs, LPNs, et cetera, or is this already part of the model?
Yeah, the ability to use the mid-level primary care practitioners, so NPs, PAs, is something that we continue to look at in the model because of the way some of the systems have structured their primary care practices. And as you think about the way Wisconsin operates, there's always a supervising physician who is really sort of in charge of the nurse practitioner or the PA. Using the look at that team and their performance is something that we brought into the mix to look at, can we continue to expand access to primary care? And it's something that we're making operational as we go forward.
Okay, the next question is for on-site and near-site clinics to take advantage of the data from the WEO study on high-performing specialists and the ability to refer to those high-value specialists. Does an employer have to be a Centivo client currently, or is there a product offering independent of Centivo?
I think somebody may have been reading the BHCG Catalyst newsletter. There is a real push and an opportunity that we have developed from a product standpoint that says for the employer who wants to use the data simply for their on-site and near sites, that is a product that is available to BHCG member employers. And it is something that Centivo will help facilitate. Which essentially is happening is we're using the Centivo referral portal and the Centivo data that sits from the physician value study and allows the on-sites to be able to move in that direction. So for those employers who want to start down that path as quickly as possible, that is something that's available today. We have a number of employers who've said, that's what I want my first step to be. And then I will look at potentially providing a Centivo offering to my folks as my next step. And so it is a multi-step process. So you don't need to be a Centivo client to be able to take advantage of it. There is frankly a opportunity from a financial standpoint that if you move down the path of becoming a Centivo client, the work that's done with your on-site is included in the implementation. To the extent that you're not becoming a Centivo client, then there is some level of financial charge that goes along with using the processes. So employers are going to have a choice from that standpoint. But the short answer is yes, that data is available, and yes, the process is available, and Centivo works with your on-site to make that happen, help make them a better patient manager.
And from our perspective, if there is an employer or a trusted advisor, broker, consultant that wants to look at moving this forward, any employer can join the business healthcare group at any time. So this is an opportunity that can still be put into place, as Dave indicated, in a very short time. And we are working with one of our largest member employers to move this forward, so the template is in place. And also one of the, and also, to be frank, with Ascension, to utilize the resources available from Centivo for this solution. So a couple of additional points. One, I think you see there are multiple reasons for celebrating success, even in the face of the pandemic, with what we have been able to move forward. The business community and BHCG has been able to move forward with our best-in-class strategic partners. And the support and this cannot be diminished, and the collaboration from the health systems and provider groups to work once again with the business community and BHCG to drive the successful implementation of the solution with Centivo. And without the ability for all of us to work together, obviously this would not have been able to occur, especially in the short time that we moved this forward. So thank you to the health systems and provider groups who made this happen. And once again, on March 30th, we are going to hold our next Delivering Value Series Symposium in which we're going to go into more detail on the ability for health systems and provider groups to utilize the deliverables from WIO and the scorecards that they developed from the second iteration of the BHCG-GNS physician value study. We're incredibly excited about that opportunity, and also on the opportunity for the health systems and provider groups to actually receive those deliverables from Dana Richardson, who is the CEO of WIO, and she has communicated with representatives of effectively all of the health systems and provider groups that were encompassed in the GNS study on what they can obtain from WIO. So once again, very excited about that opportunity and the ability of the health systems and provider groups to improve physician performance within their organizations through utilization of the scorecards. So would like to thank all of you for taking time out of your incredibly busy day to join us. And I'm hopeful that you really liked what you heard and are enthused about what Centivo has brought forth for the business community in Eastern Wisconsin and for the rest of the state in 2020. And if you are interested, feel free to reach out to me, and would also like to thank the broker consultant community for the support that they've provided to not only the business healthcare group, but Centivo, and the recognition, once again, of what the health systems and provider groups are doing to move forward to improve the delivery of healthcare and what that means for the state of Wisconsin in its entirety. So with that, if you have additional questions, feel free to, once again, email them to me. And I would also like to thank Ashok, Janet, Dave, Paul, and Dr. Bavishi this morning for taking the time for the development of their presentations and also for the time that they've spent with us this morning. So with that, thank you very much and have a great day.
Thank you, Jeff.